Pineal Stories is intended for information and educational purposes only. The content shared on this podcast should not be taken as medical advice. We aim to raise awareness and foster thoughtful discussion around symptomatic pineal cysts. We are not providing medical guidance or diagnosis. Always consult a qualified healthcare professional regarding any medical concerns or decisions. Every individual situation is unique, and only your doctor can help you determine the best course of action for your health. Hey everybody, thanks so much for joining us again. We're here with Michelle this week, and well, here we go.
So my name is Michelle Wharton, and I am now 46 years old. I live in Canada, so I live in northern British Columbia. And previous to both kind of the complex nature of my medical conditions now, additionally discovering that I had a symptomatic pineal gland cyst, I was a dental hygiene practitioner. So I practiced in dentistry for over 20 years. I own my own dental clinic. So I actually opened the first independent dental hygiene practice in northern British Columbia in 2015. And so I worked for general practitioners and orthodontists up until 2017, I want to say. 2015, I started my independent practice, and by 2017, I was exclusively operating my dental hygiene clinic. So unfortunately, my last clinical day was February of 2023, and that was because of both my immune conditions, and really the symptomatic pineal gland cyst was what ultimately led me bedridden for about 8 months, quite frankly. And as a result of that, I had to sell my dental practice. So I am what you would call medically retired at 46 with no pension. I put every bit of effort and love for my profession into my clinic, and it was absolutely something I really loved from the bottom of my heart. And because of my medical conditions, I am no longer able to practice. Yeah, not because of the outcome of the pineal surgery. The pineal surgery was very successful, but the other conditions that I've acquired over the duration of the last 3.5 years have ultimately led to me having to retire medically. Yeah, so no longer working.
Okay. So when did you first notice the symptoms? I assume that it happened for a while before you made
It
that
did.
decision.
It did. Yes, of course. So I up until December of 2021, I was a vibrant, thriving, very active healthcare professional. And so when I talk about active, I'm talking backcountry skier, like avalanche pack, in skin skiing in the backcountry, hiking 60-pound backpacks. You know, I've got 2 small children. They're 14 and 11 now, and my spouse, with my partner, and incredibly healthy. And like I said, I served the community for 20 years, and December 2021, that changed very radically for me. And my story is fairly controversial, unfortunately, which, I mean, realistically, it shouldn't be, because it is ultimately a health related issue. It shouldn't be political. But my initial onset of symptoms was related to my second COVID vaccine. And so within a couple of days of my second dose, I started experiencing severe neurological issues. And that included everything all encompassing that's associated with a symptomatic pineal gland cyst. I'll kind of go back and forth between notes, but that was headaches, fatigue, dizziness, cognitive issues. The insomnia didn't really arrive until probably around, I would say, like 14 months later, from December 2021. And then ultimately, the initial investigation post vaccine injury was for MS. And so I had a whole slew of other symptoms that were associated: hot spots in my legs, blurred vision, tunnel vision, double vision, signs of neuropathy, incontinence, gait disturbances, severe cranial pain and pressure and nausea arrived around a year later, ultimately around the fall of 2022 was word finding difficulties and a memory loss, short-term memory loss, immense cranial pain and pressure. And by 2023, the fall of 2023, so that was just shortly before I went for brain surgery, I had complete intermittent vision loss in my right eye. And so what I would later learn from Dr. Patel is that the pineal gland cyst was actually causing brain compression. And so my initial investigation, which started in January of 2022, was a substantial amount of blood work. And I was assigned to an MS neurologist who was investigating me for MS. And that was the beginning of a sequence of MRIs, so brain MRIs. And my first MRI was in February of 2022. And at that time, they identified a parietal lobe lesion, which didn't and wasn't conducive to MS. My symptoms necessarily weren't conducive to MS, but the MS neurologist at the time, when I ended up having an appointment with her remotely, was concluding that it was not conducive to MS, that it was either vestibular migraines or post-vaccine injury. And to date, I had never had a history of migraines. And so they began treating me for vestibular migraines. And so that
Okay.
was sort of their interim diagnosis. And I followed that MS neurologist until January of 2023. And so they did a repeat MRI in July of 2022. And my family doctor at the time, in the fall of like September 2022, they talked to me and said that everything was perfectly fine, that there were no changes in my imaging, that I no longer needed any imaging. And at this point now, I'm canceling my days at work. Of course, I'm a hygienist. My vision's very important. And it's pretty notable and pretty important to recognize that I actually had zero changes in my vision. Obviously, I wear prescription glasses. I have since I was like 12. Now I'm 46. I had no changes in my prescription in 20 years, like nothing. And of course, vision is very important with what I did for a living, as with tactile sense in my hands. And I actually have significant nerve damage in my hands and feet as well now. And so they said nothing was wrong. I disagreed. I said, given the very severe acceleration of my vision issues. And so vision was like pulsing, like I'd have almost like my vision was like moving and I couldn't focus properly. And I had blurred tunnel, snowy vision, like aura a little bit, but not entirely. And I didn't have extraordinary headaches up until around that time. And then they started getting like terrible, like terrible. Nothing like I've ever experienced in my entire life. I can tolerate a lot of pain, and badges of honor for pain are not something that anyone should wear with pride, but I tell you, I've experienced an extraordinary amount of pain. And so I disagreed, and I really wanted a follow-up MRI, but my family doctor at the time didn't think it was necessary. And so I had my first, my regular vision appointment. And at that time, they noted signs of visual deficit. And so the only way I could explain it, trying to explain to the doctors, that I felt like I had black spots missing in my sight. And so I would look, but there would be pieces of my sight that were missing. And that showed up on my visual field test in 2022. And so there were signs of the beginning of peripheral, or not, some peripheral damage, but not mostly isolated and very localized spots of sight that were missing.
So
And
you have all that happening,
yeah,
and you're being told, no, you're good.
I was, nothing's wrong. You have vestibular migraines, nothing's wrong. No more imaging is needed. And I said, that's impossible. I went from extraordinarily healthy to like, everything is wrong at this point right now. I'm trying to keep my life together. I'm trying to, canceling days at work. I'm, rescheduling patients. Of course, like I'm not working if I'm not like, feeling well. And November 2022, I received a call from the MS department, and they said, Michelle, we need an MRI right away. And it surprised me. And so I had the MRI. I didn't hear back from them. And I actually didn't hear from the MRI clinic until January of 2023. So I phoned the MRI department, or I'm sorry, the MS department. I phoned them in December because now things are really bad. If I couldn't imagine, I always is, if I couldn't imagine they get worse, and I still to this day I can't imagine, but it got worse. And so I phoned and I spoke with the nurse, and so she's like, well, the neurologist did want to see you, Michelle, in December. I said, well, it is December. What does my imaging show? And they said, well, your parietal lobe lesion is stable. And I said, okay. And they said, and the brain cyst is stable. And I was like, excuse me? What brain cyst? And they said, it just says it's stable. And I was like, since when? And they just said, I'm sorry, we don't know. You need to talk to the neurologist. So that's how I actually found out I had a brain cyst. And so I was like, what on earth is this? And so I started researching pineal gland cysts. I came across Dr. Patel's articles and his like ongoing research. And I kind of just left it at that. Most of my symptoms to date at that point really mirrored a symptomatic pineal gland cyst. Some were unusual, which I still have today, which we now understand are autoimmune conditions and other neurological conditions that have developed since my vaccine injury. And so I finally had another, again, remote call. And again, this is all throughout COVID as well, too, right? So I actually, up until May of this year, so May of 2025, I finally saw a neurologist in person in Canada. Can you imagine?
Oh, wow.
So I've gone for
Wow.
3.5 years and I've never seen a neurologist in person in Canada until just this year. And so I saw the MS neurologist. She said, no, Michelle, you don't have MS. But I said, well, what about this pineal gland cyst? And she was polite. She said, well, it's an incidental finding. And I am unaware of any impact that it has. And I said, well, research is saying otherwise. And so what else can you also tell me? It says stable. When did this show up? And she said it was on your July 2022 MRI. And I said, well, why wasn't I told about it? And she said, well, the radiologist didn't write it down. So they actually didn't document it.
Oh,
So it was there from July of 2022. And I had no idea until the phone call that they expressed it. And then my final confirmation was with the neurologist in 2023. And so their answer at that time was continuing with vestibular migraine treatment. My heart rate was incredibly erratic and had been since my first injection. And I'm talking like 198 beats per minute standing in my kitchen. My blood pressure's like plummeting. And so my heart rate, so I am diagnosed now with POTS, mast cell activation disease, immunodeficiency, small fiber neuropathy, substantial peripheral vision loss because of my small fiber neuropathy. And I am waiting for a specific brain scan to check for signs of either mini strokes, potential aneurysm, and or what they call AVM, and that's an arterial venous malformation. And so because my immune system is so compromised that all of my vascular integrity is compromised. And so oftentimes what can happen is if the blood vessels are weak, especially 90% of the blood vessels in your brain are small vessels, they can reform into these bundles where the flow of blood is not what it should be. And so that's what we're looking at. And so they're associating my ongoing vision related issues, especially peripheral, with the conditions I now have post-vaccine, not from the brain surgery. And I've had ophthalmology, neurosurgery, and a traumatic brain injury specialist all say the same thing. They're like, yes, Michelle, you would have perhaps like ongoing blurred vision from the surgery, but the rest doesn't align. And I've talked to Dr. Patel multiple times about this as well. And so they put me on a beta blocker. They said, let's try to regulate your heart rate. Let's work on amitriptyline for migraines. And I spent from that time basically until November of 2023 in bedridden with all the associated symptoms to a pineal gland cyst, and no one in Canada to help me. And I continued to ask, and no one would help. No one would talk about it. And so I finally found Dr. Patel at MUSC. So I called MUSC myself. I was referred to another neurologist in Canada for pain management. That was the only thing they offered me. And I never saw that neurologist until September of 2023. And so my appointment with Dr. Patel, I called and asked, and I said, does he see international patients? And they said yes. And so I booked my appointment with him. It was August of 2023. And in the meantime, we tried everything we could. I had anticoagulation blood therapy. I saw a heart clinic. They determined vascular damage. I saw a audiology clinic. They determined there was no peripheral nervous system issues. There was no vestibular issues. It was central nervous system. And you got to realize, like, I'm a healthcare professional for 20 years. So everything I do is based in science and literature. And for me, I'm just like checking off boxes. Like, I'm okay, let's like figure out what it's not. If we can figure out what it's not, we can figure out what it is. And ultimately, my hope was that we could figure out what it is, come up with a solution, and also just rule out that it wasn't vaccine injury, because I didn't want it to be that, because we still to date have no solutions for that. I'm part of ongoing research for that as well. Personally, similar to my brain tissue being donated for Dr. Patel's MUSC research, I also have blood draws that are sent to Germany for vaccine injury research as well. So we can hopefully come up with a solution.
Wow.
And that's where we were. We were pretty much abandoned in Canada.
That's awful. So I was thinking about Kelly's journey. She had the cystic enlargement of her pineal gland. But
Yeah.
along that journey, we also found out that she had breast cancer. And so there were layers to sort of sort through and well, this belongs in column A and this belongs in column B.
That's right.
Sounds like you did quite a bit of that yourself. And what you believed to be in the pineal gland cyst column pre-surgery,
Yeah.
did that turn out to be the case post-surgery?
Yes, indeed. Yes, indeed. So I visited Dr. Patel. I explained my symptoms. He looked at my imaging from Canada. So no new imaging, and my story. And it was funny because when I saw him, I had my list and I wanted to like read my list of symptoms because I was so forgetful, and he wouldn't let me. He wanted me to he wanted to hear me talk. And I didn't realize he kept asking me over and over. And I was like, it took me a long time. And obviously I'm quite articulate, but my goodness, I couldn't put one word in front of the other at the time.
How
Yeah.
big was your, how big did they say it was on your?
5.5 millimeters is how big it was.
Okay.
Yeah.
So
so
again, we have heard that's kind of in the average range. We've had people with smaller ones that have had pretty severe symptoms than people with much bigger ones. Is that
Yeah.
what it was after surgery? Do you know if it changed at all? Mine changed just a little bit. I think
It was measured at 15 millimeter
it's,
for MRI, and then actually it was 17 millimeter.
yeah, when they took it out. It was 1.7 centimeters when they took it out.
Well, the tissue that they removed was 1.2 centimeters. So it was significantly different. But yeah, I went into surgery with all of those symptoms. And the other part to keep in mind as well is that I'm from Canada. So none of this was covered. So I firstly needed to decide if I was going to have the surgery. Then I also needed to figure out how much it was going to cost.
Yeah.
And so I came home from Canada, and we had obviously talked to my family. And I mean, there's an extraordinary impact with this. As you know, Kelly and Michael, you both know this just doesn't affect the person that's suffering. Your
Right.
entire family it's significantly impacted. So when I'm preparing to go for surgery, I literally had to sit my children down and talk to them about death. Right? Like, I felt very confident in Dr. Patel's hands. I asked all the questions, 95% rate in the success of the surgery, 80 to 90% reduction in symptoms. I was very confident. And when you meet him, and my spouse had the opportunity to talk to him because Dr. Patel called him like right after the surgery himself to let him know that I was coming out of recovery. You just know, right? Like, you just have that he's such a wonderful human that
So
you're like,
warm doctor.
He really is.
I was like, oh my gosh, I'm acknowledged.
Yes.
He
I'm
seems
not-
very human. There are
Yeah.
some doctors that just sort of have this sort of wall up, and I get that. They have to kind of distance themselves from the patient, but
Yes.
it makes you feel more at ease. He's such a
Oh,
warm just sort of
Entirely.
down to earth guy,
Yeah.
you know?
Entirely. And that for me, I was just like, okay, I'm going to be okay. Like, I'm going to get through this.
Yes.
And for me, it was like, I don't have any other solution. I have no one, so no one's seeing me in Canada at this point. Now they know what the onset of my injury, and I have like 16 to 18 rejection letters in Canada from all kinds of specialists,
Mhm.
immunology, neurology, ophthalmology, hepatology, you name it. I have everything, cardiology. Finally, I have a team in Canada as of 3.5 years later. And so we really needed to figure out how much it was going to cost. And it was just under $148,000 Canadian. And we paid
Wow.
out of pocket.
Wow.
Wow.
I sold my dental office. We liquidated it. A friend of mine started a GoFundMe, and they raised 70. This is like a lot. But they raised $74,000 across Canada in 31 days.
That's amazing.
It was
very-
extraordinary, like extraordinary. So we could pay for it. We could pay for it. And it cost to date $220,000 for the surgery and the visits and the stay and the return visits and all the things. So I mean, it didn't come without a great cost.
Sure.
Health.
What a wonderful community that
Oh goodness, right?
that
And I mean,
helped
if
you
that's
there.
like
That's a
you
testament to your character there to get so much help.
for sure, right? And so we got the money and away we went. And November 20th was the appointment, and we had 4 flights down, and I was now flying. I'm not sure, Kelly, if you had this issue, but I had no idea how painful flying was going to be.
Oh,
I,
yes, ma'am.
We
Oh,
we
well, so
suspected,
So-
so we drove
I already knew. just
16
be-
hours from here to there and back.
Yeah.
16 hours back.
I already knew, and I think it was because I was so used to literally waking up. Mornings were horrific with head pain. And there were days where I would just be in bed with ice packs,
yeah,
literally tied. Michael would help me. He would help me tie them to my head and put the ice pack in the right spot.
yeah,
I knew that any pressure change, I wasn't going to be okay with that. So we didn't even try. We didn't
Yeah.
even try to fly. I just,
A little harder from Canada.
right.
It
Yeah. I can
really
only
was.
imagine. Yeah. The
Yeah,
thought
everything you just said, Kelly, about the ice packs. Yes, like I remember my mom, like no one would leave me alone, and my mom lives in Edmonton, which is like 7 hours away. So when my partner would be away working, which he is a week out of every month, my mom came to stay with me, and she would be passing me ice packs, and she's like, "Honey, how are you putting this on your head?" And I was like, I could barely feel it, but it
yes.
felt relief. Like I had migraine caps like that you pulled like right over your head, and
Mhm.
mom would just cycle through migraine caps. And then I was like light sensitive, auditory sensitive. I was in the dark. I was in the dark for 6 weeks with my blind closed, sunglasses on and earplugs. My kids couldn't come around me. It was horrible. I was like a prisoner in my body. And I explained to my partner at the time, I felt like I'd aged like 2 decades in a year and a half. Like I felt trapped, and I couldn't express it because I couldn't find the words to say what I wanted to say
Oh
by
my God.
by the
Trapped.
end.
Yes.
Yeah. And my sight was like a projector screen, like it was glitchy, like, and it would come on and off occasionally. And then ultimately it was the intermittent right eye vision loss, which Dr. Patel explained as brain compression.
And not being able to find the words to express yourself. I remember being so frustrated because, and I would try to explain to Michael, like, I'm me, the me that's normal and healthy is feels like it's trapped inside my head, and
Yeah.
it wants to take over and explain how I'm feeling, explain what's going on, but it can't. I
Yeah.
can't find the words. I mean, there were days that I couldn't even remember what a banana was.
Yeah.
And I knew that I knew, like, I knew that I should know, I guess I should say. But yeah, it is like feeling trapped in
I'd
your
walk into
body.
a room and I'd forget, and I'd come back, and then my kids would write their lunch kits on their name on their lunch kits, and everyone was trying to help me. Like I would go in and come out, and then Dave is my spouse, he'd be like, "You were looking for this." Like they would tell me what I was
Oh.
doing. I was like, right, Kelly? Like you're so just like, oh, I
Yes.
know I'm here, but I'm so I'm a prisoner.
You're a prisoner, yes.
And so, yeah, so we had 4 flights from where I lived to Charleston. I was throwing up in the Vancouver airport on my first flight. I had to pretend I was okay to get on my third flight
Yeah.
because they weren't going to
They're
let me on
gonna
the plane. I
right.
got kicked off of WestJet Airlines because I tried to get a companion and get his flight accompanied, and I was too much of a health risk. They wouldn't let me fly.
Uh,
So I didn't say anything, and we paid for everything and went with Air Canada and didn't tell them.
Hmm.
And we got to Charleston, and my surgery was the 20th of November, 2023. And
oh my gosh,
within
almost a month after mine.
Yeah.
Yeah.
within 2 days of my surgery, gone. Like literally gone. Like besides, I mean, obviously we're on Oxycontin, which they didn't keep me on for very long because it didn't work very well. But Dave looked at me and he could see in my eyes that my eyes were okay, that I wasn't in pain, that I could move them because I couldn't move my eyes down. I don't know if you had any palsy, like I couldn't move my eyes down. I couldn't look down.
Mine
Um,
was more, I actually lost, it was so weird. I was taking a shower one day and actually lost most of my vision. I come out of the shower and I'm screaming and I'm telling him it feels like my eyes are being stabbed and I can't see. And it was
yeah,
like white clouds in front of everything. I had a little bit of shadowy vision, but might as
yeah.
well have not been able to see it all. I had just very strange episodes like that. That was the worst one where it kind of felt like I was going to be blinded like that. But then I would get double vision. I didn't necessarily have trouble moving
Your
my
eyes.
eyes unless
Yeah.
I was having a seizure-like activity. In that case, yes, I
And
definitely.
I'm not sure if I had like absent seizures, because I didn't have full seizures, but it was like absent seizures. Like I would have moments of such disorientation. And so we still to this day don't know if that was the case.
Yeah.
So for
Um,
me, they actually did try to capture what was going on. I was sent home with all these electrodes and a machine to try to capture
oh,
seizure activity. And
okay.
it wouldn't show anything, but Dr. Patel explained that seizure-like activity is very common with
Okay.
these, and mine manifested in all kinds of different ways. Sometimes just purely physical. My muscles just seize up. It was very
Mhm.
painful. Um, there were times where I would just kind of blank, zone out, forget what I was saying. All of those were kind of attributed to quote unquote seizure-like activity, but
Yeah.
never was there ever a time that they captured anything specific. Just here's what's happening, but we haven't been able to get one on, you know, on a test
Apparently, that's
Which
very
is
common to have all the benefits of a seizure, but without the diagnostic capacity to show
benefits.
that anything's actually happening.
And
Right.
that's what leads to so much gaslighting,
Yes.
right? There's
Yes.
so much
Yeah.
medical gaslighting. Like
So much.
I provided the head of neurology at the University of Alberta, which is in Edmonton, provided her with all my imaging. Same at that time. I mean, I was very aware that the pineal gland cyst had showed up. And she essentially tried to minimize it to childhood trauma.
Uh,
So she actually accused me of having buried childhood trauma that was causing me to manifest my symptoms. And I couldn't even believe it. Like I was just, my mom and I were just mortified. I was like, are you kidding me right now? I was like, this is how you treat your patients? Like, but this is gaslighting at its finest. And I mean, I still exhibit gaslighting to this day
I
from
am so
doctors.
sorry. That's
It was
horrific.
absolutely well, and then of course for my family, my mom was mortified because she was just like, "What?" Like, so what it boils down to really is they don't know, and it's their ego,
Right.
and they're
Mhm.
Yeah.
not equipped to. And from being a healthcare professional and being regulated, our responsibility, firstly, is to do no harm. So guilty
Mhm.
by omission is harm. Staying up to standards on the current research and literature. And one thing I admired most about Dr. Patel is that he actively tried to help me find a neurosurgeon in Canada that he could work with so that they could learn, they could
Oh,
do the surgery, and I could not find a single neurosurgeon in Canada that would accept his offer. So, I mean,
yeah.
if you talk humility, you can't find any more humble than him, because he really wants to help his patients and advocate for them. And so I tried to find neurologists neurosurgeons in Canada, and I couldn't find anyone, but that's how I was treated.
Yeah.
But yeah, when I say honestly, both like Michael and Kelly, like within days after my procedure, I absolutely was like, oh my goodness, I have my life back. I have a part
You
of my
knew.
life back. I was so
You knew.
hopeful. And my
Yeah.
trajectory was very successful. We didn't end up flying home actually, because Dr. Patel was concerned. I was concerned. So my brother, God bless his soul, he drove from around the Ottawa area in Canada, drove to Charleston, picked us up about
Wow.
3 weeks after, drove 7,000 kilometers to get us to
Uh-huh.
Winnipeg, Manitoba. We rented a car and we drove 5,000 kilometers to get back to British Columbia. And that's how we got home the beginning of December. So I made it home for Christmas. Surgery went well. I had one incision that came loose, so they actually had to redo a few stitches. I didn't respond well to the oxy. I ended up responding well to the muscle relaxers. So we switched that at around day 4. And outside of that, I mean, my recovery was well on point. By the time I saw Dr. Patel 3 months post, like 80 to 90% of my symptoms associated with the cyst had resolved, which was absolutely extraordinary. I had a little
Amazing.
bit of blurry vision in my right eye, nothing wrong with my left eye. And that, of course, I mean, they drilled through the back of our head.
Yeah.
Of
Yeah.
course,
Yeah.
there's going to be issues.
Absolutely.
There's swelling, there's nerve integration, there's neuroplasticity, there's, the tissues healing, the dura's healing. There's so many things happening, but my outcome of the surgery was extraordinary. Like, I did not have any complications whatsoever. And where I am today, unfortunately, the conditions I have and the symptoms I have nothing to do with the surgery. They have to do
Right.
with all of the other neurological and immune conditions I had listed
Well,
previously.
that's awesome to hear.
Oh, and I say this now, and I said it before, I was very clear that we were hopeful that this was going to give me a fighting chance, because we
Mhm.
didn't know how severe the cellular damage was systemically, and it did exactly that. And if I had the opportunity to do the surgery again, to have the resolve I had, to have the symptoms reversed from the symptomatic cyst, I would do it 100 times over.
Okay. I always ask everyone
Yeah,
that.
Kelly asks everybody that
100
question. It's
times,
always the
Preemptively, I
same
appreciate
answer.
that.
100
I
times.
also just want to say that your story particularly, I mean, everyone's is a testament to this, but I think yours particularly, especially because yours was completely you had to pay for it out of pocket. You're coming from a different country to get surgery in not in your home country, to show that how severe and how life altering these symptoms are. You're willing to sell your business. You're willing to, I mean, that's a lot of money. It's a lot of time. It's a lot of miles traveled. It's a major brain surgery. That to me is a huge testament to the absolute need for the education of more neurosurgeons, doctors, PCPs to understand and recognize that pineal cysts are symptomatic. Some, maybe there are some that are not, but they need to take these seriously when people show up with symptoms and the only thing they find is a pineal cyst. We
That's
need
exactly
to
right.
we need to take these patients seriously. And I think yours is an excellent, excellent example of that. I mean,
And
you're
I
not
think
gonna who's gonna do all of that,
and I
Yeah.
think like the one thing, and this is what I discussed with, so I did finally see a second neurologist. This was before the surgery, and I asked him point blank about the pineal gland cyst. The only solution he offered me was trial injections for pain management, and I was like, absolutely not. I'm not interested in a Band-Aid. And so when I asked him about the pineal gland cyst, and at this point in time now, I've seen Dr. Patel. I'm aware of their research. I'm understanding that they're looking at mRNA sequencing. They obviously did the biopsy of my cyst. It showed mast cells. So now they're progressing on mast cell investigation and some ACE2 receptor like research. It kind of, it's all overlapping a little bit. So I love that stuff.
Interesting. Mine showed the same. Mine also
I'm a
showed.
crazy research nerd. And so
Yeah.
mast cells in particular, they shouldn't be found in your brain. And if they
Right.
are, they're in very low amounts. And so when they are in your brain, they're not degranulating, so they're stable. Mast cells are in our skin, digestive system, all of that. And so I do now have mast cell activation syndrome, which I didn't have prior to December 2021. And so I have ongoing reactions systemically to everything. I'm literally allergic to myself. My immune system is not recognizing itself, and as such, it's damaging my nerves as a consequence of not identifying what is foreign and what is not foreign. And so mast cells release a variety of chemical mediators, which they're supposed to do to help us, bee stings, allergic reactions, right? It shouldn't do that in our brain. And so how he's explained it to me is that these chemical mediators that are being released from the mast cells degranulating are contributing to the chemical effect in the brain, resulting in it being symptomatic, and that it's not just the size, which is very important.
Very important.
As
Yes.
it isn't just the size. Yes, you can have brain compression from a large cyst, but if
Those
indeed,
chemicals,
exactly,
are
and
bathing
those
your brain with things
chemicals,
that shouldn't be there.
that's
Yes.
right. And the pineal gland, it regulates your entire endocrine system. So like sleep cycle, melatonin, female hormones, male hormones, testes, parathyroid. That's a lot of chemical reactions that happen on a regular basis every day that significantly impact the autonomic function of your body. And to understand that there's more to this equation, which I commend him on his research and his like initiative. I also commend him on sourcing funding privately. And so I've talked to him on and off since my surgery and provided literature that I find. And then they actually reached out to see if I was interested in being like a spokesperson for MUSC for their research and as a patient that's recovered and recovered well. And I said, absolutely. I absolutely believe in the research they're doing. I do believe they have a much larger, there's a lot more to discover with the research that they're doing. And I think that it's going to be so important. What we need are more physicians and surgeons and neurosurgeons equally globally to be on board with learning, because science is learning, science is staying curious, and they're not doing any of the above. They're stagnant at the expense of patients being commodities and suffering in silence. And what's quite unique or quite interesting, like with my story of being from Canada, I'm not the only one. In like 20, somewhere between 2011 to 15, there was a young woman in Calgary. Her parents remortgaged their house. There was a gentleman in British Columbia. They sold their company. And there was another gentleman in Northern Alberta that he financed his life and his hard work for surgery in the US. And that was in California. And two of them went to Texas. And the young lady, I've tried to connect with them. I haven't been able to, but the young lady, I ended up finding her. And so she was in university at the time when she was diagnosed with the cyst and it being symptomatic. I think that's the important part, is like symptomatic pineal gland cyst, because you say pineal cyst, it's like, oh, whatever, it's not a big deal. It's farthest from the truth. She was able to finish university. Like, she's a psychologist. And so she's another testimony to the success of the surgery when patients are listened to. And the University of Calgary actually published a paper in 2016 on symptomatic pineal gland cysts. So it's not that there hasn't been discussion in Canada. And when I read the paper, many of my symptoms that were associated to the cyst mirrored the paper, but they just won't take the time to learn. And I just, for the life of me, I don't understand why. And I really appreciate what you guys are doing, honestly. And also Dr. Patel and his team. I forget the neuropathologist's name, but Chuck or Norris is his last name. I forget his first name. But I've had an opportunity to speak with him via email as well. And I thank them every day for giving me a version of my life back. My life looks nothing like it looked before, I'll be honest. And it's not because of the surgery, it's because of the outstanding conditions I have. My conditions they're chronic. And we don't know if they're reversible, and they are progressing. and I'm undergoing blood infusions now monthly to restore my immune system. So I'm undergoing IVIG, and I do now have a team here in Canada, neurology, neuro-ophthalmology, that's overseeing my care. But with the surgery itself, he literally gave me my life back. And if this is the version I get to live versus the version before the surgery, as hard as it is to say that I would accept it, I would, because I could never express the amount of pain that I experienced before that surgery. And Kelly, I'm sure that you can attest to that. It's like nothing.
Absolutely.
I
I say the same thing. I say when people ask me about the surgery, I say the same thing. He gave me my life back. He literally gave me my life back.
you did.
I was not living by any means. I wasn't working anymore. I wasn't able to take care of my kids. I was missing out on major milestones. I was miserable. I wasn't able to eat very much. I lost over 100 pounds. I looked like a skeleton. I had delusions. I had the worst, most horrific head pain I've ever had.
Yeah.
A seizure-like activity. It was literally like hell on earth. It just wasn't a life.
Yeah.
And I would
Yeah.
absolutely do it again. And he definitely gave me my life back.
Yeah, no, I agree. I agree, with the exception of like every day for me is pretty severe pain, but it's neuropathic pain. So it's like electric shocks in my hands and feet, and that migrates to my knees and elbows. My pulmonary function is compromised because of my immune system, and I have pretty severe bone and joint pain, and all of that's immune mediated and then neuropathy mediated. But
No,
outside of that, and it's terrible. It's painful. It's terrible.
I was just going to say, I'm sorry that you're in chronic pain. I am too, but it's not from the cyst.
Yeah, that's what I was going to say. It's not from that. And even having like those symptoms, which are terrible, to
Right.
not have the cranial pain and pressure prior to, it is a version of life that I get to live. And even though it looks different, there's blessing in there. There's blessing
Yes.
in there.
I think mine is mostly because, like Michael was saying, we did find out that I had breast cancer during the whole process of getting diagnosed, getting help.
Yeah.
And now I have to be on a daily cancer drug that actually causes pretty bad bone pain. I mean, and just lack of energy. But honestly, I'd rather have this than what I've
Isn't
had
that,
before.
I think I said that at the beginning about her badge of honor for pain tolerance, and we shouldn't be proud to wear it, but you're right. Like it's what I don't know, we learn to tolerate what we can tolerate. And I would, as sad as it is, I agree with you, Kelly. Like I would take what I'm
Yeah.
experiencing now over what I was experiencing before,
Yes.
which is sad to say, but it's
I
true.
know.
Yeah.
Very
Yeah. But I
sad,
mean,
but true.
I'm hopeful, right? Like, and even though we don't know what's in store for me, I'm still hopeful, and equally as hopeful as I was before the surgery. And so I remain optimistic. I'm not a rose-colored glasses person, but I definitely remain optimistic. And I would do the surgery again. And I think for people that are suffering with the symptomatic pineal gland cysts, like firstly, knowing that you're not alone. So the fact that you guys are sharing people's testimonies is extraordinary. I actually didn't find the pineal gland group until September of 2023, if you imagine. Of all the places I never thought to look on Facebook, I didn't. And then when I found the group, I was like, oh my goodness, I am not by myself in this. Like there's thousands of people. And so that was a huge relief for me because I was so gaslit and it was so devastating. But certainly for them to know they're not alone. And the surgery is not for the faint of heart. Recovery is not linear. It doesn't happen overnight. Recovery is not overnight. And to lean on individuals like myself and you, Kelly, and other people that are brave enough to share their stories, to know that it's possible to come out on the other side of this if you can find a doctor that will listen, to have a version of life that is significantly better than previous to having it removed. Yeah.
Absolutely. Well,
Yeah, we have people from Sweden and Switzerland and Australia and a few other places who are lined up to do this podcast. It's
Yeah.
not just a here thing; it's an everywhere thing, and we
Yeah.
are really looking forward to getting this out there, because originally Kelly and I just sat down in here and we recorded almost 2 hours of our experiences. That's what it was. And we just wanted to put it out there so that someone else going through it would know they're not the only one. That was it.
Yeah.
That's all we were going to do. And then those groups, we mentioned it, and it just started rolling, and here
Yeah.
we are. And we were actually going to interview Dr. Patel 2 days ago. We had a
Yes, I saw
scheduling
that.
thing. So we're interviewing him on July the 1st now.
Oh,
So
lovely.
he'll be episode number 5 on
Yeah.
here. So we're
Yeah.
and we're just going to do everything that we can to get as much information out there as possible. And we'll use whatever we got to use to encourage them to pay attention.
Mm-hmm.
That's a diplomatic way of putting it.
It is.
Really beat them over the head with the media, but we're going to encourage them. That's what we're going to do. So
Yes. And when I went back in February for my 3-month follow-up, my kids came with me. So my mom
cool.
and my kids came with me. My son wanted to meet Dr. Patel.
Oh,
Yeah. And he
That's awesome.
begged him
no.
for keeping his mom here. He shook his hand, and my daughter did, and my mom did, and we have photos with him, and
Oh,
my kids got to keep their mom.
yeah.
You can't put a cost on that. Don't get me wrong, there's an extraordinary amount of financial burden that we
Yeah.
bear witness to. But my kids, they said, "Mom, can we go back with you when you go?" And I was like, "Of course, sweetheart. If you want to meet him." And he's like, "I want to meet the man that saved my mom's life."
That's awesome.
It's extraordinary.
Mm.
Yeah.
Well, now that I'm crying.
Yeah. I mean, I'm not crying. You're crying.
Yeah. Well, and it's, I'm sure that you feel the same, Michael. There's a lot of things as a spouse and as a mom that you can endure. But when you have to bear witness to your children and your partner having to walk that walk with you, my goodness, it's not anything that you'd wish upon anyone. And my children were very young at the time. I mean, this is 3.5 years ago, and not young enough that they didn't know what was going on. I tried to hide it from them until I couldn't. But I tell you, my children were already compassionate and empathetic, but the amount of compassion and empathy that they have expanded through this process, those kids are just extraordinary human beings. Yeah. So I
That's
have
awesome.
to try to find some positive in amongst their turmoil, because it has taken its toll on our family for sure. And more so because of the substantial amount of gaslighting. It was
Sure.
why won't anyone listen to my mom? And even now to this day, like I said, we finally have a team that's helping us with other things. But most of it is just someone help us. That's really what it came down to. And even me, when I didn't even say anything about any of my story until it came having to go for brain surgery. And it ultimately was just a cry for help, to the Canadian government. And before we left, I tried with everything in me to get a Canadian neurologist to sign my out-of-country funding, because the provincial government was willing to pay for the surgery if I could find someone to sign it, and nobody in Canada would sign it for me. They all were just like, "It is incidental. It does not amount to anything." And sorry, the neurologist that offered me pain management, his comment to me, which was early September before I went for surgery, was that doctor's diagnosis was insanely incorrect. And that was written in my medical chart. That she
Wow.
is a neurosurgeon in America saying that it needs to be removed. The diagnosis is insanely incorrect. Written in my medical chart. Yeah. So how's that for ego and not willing to ask questions and not willing to learn? And I even at that time said, "Dr. Patel is more than happy to talk to you." And he absolutely refused to even engage in a conversation.
If you
Wow.
listen to these near the end of episode 3, there is a thing that you will cheer for, because the the woman that we interviewed, Bandina, um, went back to one of those surgeons who had said something along those lines
Yeah.
That
after
it
her
wasn't,
surgery
yeah, that it wasn't
and
necessary.
got a little dig in on him. It was
Well,
it
I've
was nice
wanted
to
to
hear.
show up in my white power suit and my red high heels, but I can't walk in high heels right now because my feet, I'm better in bare feet because my sensory loss is pretty substantial. So I need to touch the ground. But I've wanted to walk in my power suit and shake his hand and like just remind him of his insanely incorrect and that I'm here to this day to be a testament to the success of the surgery. I feel like that's not
Yeah.
with
I
my
am not
character.
going to
It's
say
not my
this.
character to do it, but gosh, I'm just
Do
like,
it.
you need to help people. You just need to help
I
people.
try to
Right?
be a bad influence on people as much as I possibly can, and I'm encouraging you strongly to go do exactly that. And if you could get a cape, perfect.
I'm not going to say this doctor's name because, like most of them, he's just not up to date with the research. But I will say he's still following, I'm still seeing him for something else. And he is a neuro-oncologist. He does brain surgery, all kinds of stuff. I saw him, I think he was the first neuro guy that I saw after my first MRI. No, second. Sorry. He was my second.
Second,
I
yeah.
was referred out to him when the first guy wasn't sure what to do. The first guy was amazing. He just didn't know what to do. And I don't really remember the visit that well because I was sort of in the middle of my symptoms, but my husband does. And we left that place and my husband's like, wow, that guy is quite full of himself,
Yeah.
quite
Yeah.
cocky. And it, I mean, I could sense that there was something wrong, but like I said, I don't really remember it. And now that I'm seeing him, he almost seems surprised when he talks to me and he asks me questions about, so do you feel, how are your symptoms now? How are you feeling? In fact, I just had an appointment with him a week or so ago.
Mhm.
And he asked me that question. I said, great. Like, he starts asking me about the symptoms I had prior surgery. And I'm like, nope, gone, gone, gone. Feeling great.
Well, and
And
I like that you say that because so I now like I said, May of just this year, and that was actually me getting a hold. So we have a minister of health in each respective province. So I finally emailed our minister of health. I emailed our premier, which is like your senator, I suppose. And I was complaining of lack of medical care in Canada and that no one will see me. And I was like, I need help for these immune conditions because I revisited the United States again in August of last year. And that's where I saw an immunologist and neurologist, and they confirmed all those other conditions I had listed. But I can't get any care in Canada if I find the exact same specialists agreeing with them. And I finally have that team now in Canada. And the neurologist that I saw was like very aware of my surgery, and is the only either family doctor or other specialist in Canada that actually accurately document my before my surgery and after my surgery. And there was no opposition with her whatsoever. She was just like, "Tell me about this surgery you had. What did you have before for symptoms and what do you have now?" And when I read her report, I was like, "Oh my goodness, she's actually accurate." Like the majority of the doctors, because I'm still in and out of emergency. Unfortunately, like I said, it's the other conditions, but the amount of gaslighting and mocking that I get here in the emergency room is devastating. And all of the doctors are like, "Oh, you're just foolish and you just had complications to your brain surgery that never worked." And I'm like, "You're wrong, actually." Like you said about Kelly, there's this column with these
Mhm.
associated symptoms, and then there's this autoimmune condition I have that has these symptoms, and then there's this neuropathy condition that has these symptoms. They're
Right.
all very different, and unfortunately, they all are intertwined. And if you aren't asking the right questions, it's very easy to believe the narrative that you tell yourself. And so for me to finally have, like I said, now neuro-ophthalmology in Canada, ophthalmology and neurology and traumatic brain injury clinic, all of them repeating the same message to my spouse and I that, yes, Michelle, your surgery was successful. Do you have scar tissue? Absolutely. You had brain surgery, but your extenuating circumstances now and your conditions and your symptoms are not associated with that. So that's very like comforting as well for us to know that we have eyes, like all these sets of eyes on my complex conditions, and the messaging is very clear. And so for anyone that's considering the procedure, it is successful. And I can say that it is successful, but to be able to find specialists that are like humble enough to be able to say that is very challenging. And we did actually end up forwarding all of my medical records from MUSC to that neurologist in Alberta. That's a whole nother amount of effort that I'm just not willing to undertake because I need to save my energy
Yeah.
for what's next to come for us here. But Alberta Health Services is who oversees healthcare in Alberta. And yeah, they didn't really know what to say. I'll tell you that. Like when they received the biopsy that showed what it was, when they got my records saying like recovery prognosis, the success of it, the symptoms that were removed, it was far more amounted to just traumatic childhood issues. It was actually very present, and it was in my head. It was a brain cyst. Like that's kind of what we said to Alberta Health Services. Like this is actually real, and we need more surgeons on board. There is a surgeon, and he is listed on the Pineal site, Dr. Salvaggio. He's in Winnipeg, Manitoba. And I was able to talk to him 4 months after my surgery, because I was trying to get him to sign my out of country form, and he wouldn't sign it, unfortunately. But he does do the exact same procedure that Dr. Patel does, this occipital craniotomy. He did the surgery on a woman. She was roughly my age. Her cyst was over 15 millimeters. So that's the criteria that they still use in Canada. If it's over 15 millimeters, they will do the surgery. If it's over 15 and you present with all the symptoms that Kelly and I had, she recovered. And I told him my story, and he just said, "I'm sorry, Michelle, even if you came to me before you went to the US at 5.5 millimeters, I would not have done it." And I was like, "But I'm here to tell you that it worked. Like, why won't you alter your criteria? Like, Dr. Patel will work with you." And unfortunately, I just never heard back from him. And our last attempt at out of country funding was with an internal medicine doctor here where I live. And he was openly like communicated. He's like, "I'm sorry, I don't know enough about this condition, but let me see if I can find a neurologist in Vancouver that could help us." And he couldn't. And he looked myself and my partner dead in the eye and said, "I cannot sign this form for out of country funding. I do not want to lose credibility with my colleagues."
Wow.
And he didn't sign it. Yeah. So we
That's
paid
awful.
I will say,
$148,000 for surgery because he didn't want to lose credibility with his colleagues.
the size issue is also part of just their lack of knowledge on these. And even Dr. Patel has said that from his research, he's not really seeing a correlation between how big the cyst is. Sure, bigger ones can cause physical pressure and issues in the brain, but the other components, the chemicals that are being released by the cyst itself, doesn't matter, doesn't care how big it is. But that's just more knowledge that they don't have, and that just another thing that needs to change.
Yeah, that list of physicians that you mentioned that's on the Facebook group is now linked on pinealstories.com for folks that don't have Facebook or don't like using social media. So
no, Dr. Salvaggio, he does do the surgery, but again, his criteria is 15 millimeters or larger. That's still his criteria.
Yeah, I don't administer that, but do you know if that's on there? I haven't actually seen his. I just kind of skimmed over it before I put it on the website because I just happened this morning.
The last time I looked, his name was on there because Betty Tanner, honestly, God bless her soul. She's just an angel. I talk to her almost every other day still. She was the one that when I was like expressing or sharing my story before surgery, recommended him. And I tried to get a hold of his office early before I went to the States, and they said he doesn't see out of province patients, and then you need a referral. And I just never got my foot in the door. But
I mean, the 15 millimeter, that's what I'm curious if that's on there because
that's not on there. No,
okay.
I only know that because I spoke to him personally. Yeah.
Oh, okay. Well, we
Yeah.
should probably get that on there. I will
Oh,
talk to them about putting that because they do on several of them. There are, list of criteria and information about, what you can expect from this surgeon. So
yeah.
that's what we'll
Yeah. So that
need
the
to do.
size paired with all the symptoms that we're very familiar with that are associated with the cyst. Um, and I think like the word finding difficulties, the short-term memory loss, and the transient vision loss are a couple that are very important to list. And I was shocked actually with the vision loss because I had found when you talk about like globally, it was a mom in Australia, and I found her article, and she lost sight in both her eyes when she was driving with her kids in the car.
Mhm.
And thankfully nothing happened. And that's actually when I lost my sight the second time. I dropped my daughter off at school, and I was parked, and I looked and was like watching her skip away, and I was like, oh my goodness, I can't see out of my right eye. And I called a girlfriend. I was like, I need to get home. I don't know if this is going to move to my other eye. I just need help. And that ultimately was what led us to go ahead with the surgery, because I said to Dave, I refuse to live in this much pain, not knowing who you are, not being able to talk, and not being able to see. Like, I have a living will, and it's not to live like that. And everything is like it was escalating so quickly. I couldn't even keep up to the symptoms, that I could not be a burden on my family. And it was terrifying. And it was ultimately that incident with my daughter that I was like, that's it. We're doing this. And I don't know how on earth we're doing it, because we certainly didn't have $148,000, let me tell you. But we rallied, and that GoFundMe, I think, was started like October 1st. And I had to pay that surgery by November 3rd. Is when I had
That's
to pay.
fast. Golly.
It was so fast. Yeah.
Okay. So just, I know we're kind of running out of time, but
No problem.
I,
Yeah.
I am, I'm curious. So for a fellow Canadian who is starting this journey, they're having these symptoms, and now this has been seen on an MRI.
Yeah.
What advice would you give them?
If they want to reach out to me, they're more than welcome to. I'm happy to be there as a support. I've been there for multiple people that have reached out to me from Canada and the US. Outside of that, I mean, I don't want to discourage them, but it's very challenging to get any recognition in Canada. I would gear them towards Dr. Silvaggio, depending on the size. Outside of that, I would just have them lean heavily on the United States. And I'm not sure at this point if Dr. Patel is accepting international patients, but mostly to know that they can reach out to me and they can know that they're not alone. And what's quite interesting is that I know of 3 other women where I live that they all have symptomatic pineal gland cysts. And there's actually a woman that lives in Terrace, BC. So far there's 4 of us in British Columbia. And those 4 women can't get any help whatsoever.
Mm.
And so I've known that since 2023, that those 4 women, we even did an article with the Vancouver Sun talking specifically about pineal gland cysts and access to care, and we gained no traction. But I really just want Canadians to know that this is real. It is debilitating, and there are solutions. There absolutely are solutions that work.
Okay. Well, do you have any parting thoughts? Anything that
We have summed it up. I am actively advocating for both pineal gland cyst sufferers, equally advocating for those that have been injured by myself with COVID vaccine injury. Again, I said it's controversial, but my story goes hand in hand, and I'm not able to work any longer gainfully as a dental hygiene practitioner. And that's a career that I mourn, because I was cut short, at least 10 years, if not 15 years shy. But if my opportunity to serve is through advocacy and being a support for someone, I'm more than happy to do that.
absolutely. It's a lot. I think that those of us who have been through it, either on the patient side or the caregiver side, it's this insanely heavy burden, and it is, you know, you're going to do everything you can for yourself or for your loved one, and there's light at the end of the tunnel, but
Mhm.
it's still it still gets to me. When I did the intro for episode 1, we had recorded in November of last year and then changed our minds about doing the 2 and, added and add whatever. So I go back and I do an intro. And so I've already, been, this stuff is in the past for us. And I could not make it through the intro without my voice cracking, talking about getting my wife back. It's heavy and it remains. And
It is. It's something that it will stay with me forever. It will stay with me forever. Yeah. And I'm not sure if either you or Kelly are Christians. I am.
We are.
But I thank God every day for being here. I do. And I thank him every day for what he's taught me through this experience, because as lousy as it's been, there are things that I would not have learned any other way. And so I absolutely believe that there is like purpose behind the suffering, and I can see that, and I wouldn't change it, even though it's been so challenging. And you're right, like it's not something that I don't grieve every day. I've grieved a lot over the last 3.5 years, but that's where hope for me comes from. And so even though there are days that are still really difficult, just knowing that there's hope with Jesus, it's amazing.
Absolutely.
Yeah.
Absolutely. Okay. Oh, yeah. Well, we're just going to
Thank
keep
you.
making it heavy here.
No, it's not heavy. It's hopeful. It is.
It's
It is.
hopeful.
These aren't tears of sadness, and by any means. They're
Yes.
absolutely tears of joy, because I'm still here, and so that's remarkable. And I think that ending on that note, it's not sad in tears of sadness. It's absolutely tears of joy, and
Joy and determination.
I am so grateful every single day. Yes.
Thank you so much for being with us. I mean, this was exceptional. Thank you very much.
I appreciate it, Michael, and Kelly. Thank you as well.
Thank you. We really appreciate you sharing your story, and I know it's going to help a lot of people.
Absolutely.
Thank you.
Thanks for listening to this episode of Pineal Stories, where patient voices matter and real stories have the power to drive change. If you or someone you love is living with a symptomatic pineal cyst, know that you are not alone. Our community is growing, and your experience matters. Share your story, connect with others, and help us push the medical conversation forward. Visit pinealstories.com to explore more stories, submit your own, and stay connected. And if you found this episode meaningful, please consider leaving a review and sharing it with someone who needs to hear it. Until next time, stay strong, stay informed, and keep speaking up. This is Michael Abels with my wife Kelly, and you've been listening to Pineal Stories. Thanks, y'all.